Before you reach for that breakfast this morning, there is something you need to know about what happened inside your arteries last night while you were sleeping. Something quiet, something invisible, something your doctor has probably never had the time to fully explain to you. And once I tell you what it is, you will never look at your cholesterol report the same way again. Most people think high cholesterol is a problem you fix with a pill. They get the number back from the lab, the doctor writes a prescription, and everyone assumes the job is done. But here is what nobody tells you. The pill manages the number. It does not fix what caused the number to go wrong in the first place. And that difference, that one distinction, is the difference between living longer and simply living medicated. Stay with me through this entire video, because what I am about to share with you in the next few minutes has changed the health trajectory of hundreds of my own patients, and I do not want you to miss the part that matters most. I am Dr. Christian O'Brien. I am board certified in internal medicine with a focus on metabolic health and preventive cardiology, and I have spent the last 15 years watching brilliant, capable, health-conscious people get handed a cholesterol number with no real explanation of what created it or how to actually reverse it without surrendering the rest of their life to a prescription bottle. Let me describe someone I see in my practice. She is 58 years old. She exercises 3 times a week, watches her portions, reads food labels, and does everything she thinks she is supposed to do. Then her annual blood work comes back, and her LDL, the so-called bad cholesterol, is elevated. Her doctor spends 4 minutes with her and writes a prescription. She fills it. She takes the pill every night. 6 months later, the number is lower, but she still feels tired. She still has that soft layer of weight that will not move from around her midsection. And deep down, she knows that something is still not right. She just does not know what it is or what to do about it. If any part of that sounds familiar to you or reminds you of someone you love, keep watching, because what follows is for her and for you. Here is what your doctor may never have taken the time to explain. Cholesterol itself is not the villain. Your body actually makes cholesterol on purpose. It uses it to build hormones, to protect your nerve cells, to make vitamin D, and to line the walls of every single cell in your body. Cholesterol is not a poison that randomly invades your bloodstream. It is a substance your own body manufactures and needs. The real question, the one that almost nobody asks, is why your body started making too much of it, or why it stopped clearing it properly. That is the question worth answering. Think of your liver the way you would think about a factory. Under normal conditions, that factory produces exactly the right amount of cholesterol your body needs, ships it out through the bloodstream, and then recycles what is not used. Clean, efficient, balanced. But when that factory receives the wrong raw materials, when it is flooded with certain types of sugar and processed fats and chronic stress signals, it starts overproducing. And when your diet does not contain enough of the nutrients the factory needs to regulate its own output, the excess builds up. That buildup is what shows up on your lab report. But here is where it gets more complicated and more important. Not all LDL cholesterol is created equal. There are large, fluffy LDL particles that float through your arteries without causing much harm, and there are small, dense LDL particles that are the ones actually linked to arterial plaque buildup and cardiovascular risk. A standard cholesterol panel often cannot tell the difference. Your doctor sees a high LDL number and reaches for the prescription pad. But if the majority of your LDL is the large benign type, your actual cardiovascular risk may be far lower than that number suggests. And if your triglycerides are high while your HDL is low, that combination is a far more dangerous signal than LDL alone, yet it often goes under-discussed. A large review published in the British Medical Journal analyzed data from over 68,000 patients and found that the relationship between total LDL and cardiovascular mortality was far less straightforward than the standard clinical narrative suggests. What mattered more was the pattern of metabolic markers surrounding it, including fasting insulin levels, inflammatory markers like C-reactive protein, and triglyceride to HDL ratio. These are numbers many primary care visits never even mention. Now, I want you to pause here for just a moment. If you are someone who is currently on a statin or any cholesterol medication, I am not telling you to stop taking it. Please do not make any medication changes without talking to your own physician first. What I am giving you today is information, not a prescription. Use it to have a better conversation with your doctor, not to replace that conversation entirely. Now, let me tell you the 5 things that will actually move your cholesterol in the right direction, without a pill, or as a foundation that makes whatever else you are doing work better. We are going to count these down from least impactful to most impactful, because I want you to still be watching when we get to number 1. And trust me, number 1 is the one that surprises people the most. If you are finding this useful, please take 2 seconds right now to hit subscribe. I put out a new video every week on exactly this kind of clinically grounded practical health information, and I never want you to miss one. Step 5. Cut the refined carbohydrates before you cut the fat. For decades, the message was simple. Eat less fat, especially saturated fat, and your cholesterol will improve. That message was based on studies that, it turns out, were significantly flawed. What the research has consistently shown over the last 20 years is that refined carbohydrates, white bread, white rice, pastries, crackers, breakfast cereals, sweetened beverages are the primary dietary drivers of elevated triglycerides and low HDL, the 2-part pattern that signals real cardiovascular risk. Here is the mechanism. When you eat a large amount of refined carbohydrate, your blood sugar rises rapidly. Your pancreas releases insulin to bring it down. That insulin signals your liver to convert the excess glucose into triglycerides and package them for storage. Over time, this repeated cycle keeps your triglycerides high, keeps your HDL low, and actually pushes your LDL particles toward the smaller, denser, more dangerous type. Your cholesterol profile worsens, not because of fat, but because of sugar. Researchers at the University of Connecticut published a controlled trial in which participants who reduced refined carbohydrate intake without significantly reducing fat saw meaningful improvements in their triglyceride to HDL ratio within just 8 weeks. The participants did not follow an extreme diet. They simply swapped refined grains for whole food carbohydrates like legumes, non-starchy vegetables, and small portions of whole grains. The results were measurable, consistent, and clinically significant. Step 4. Get fiber in ways your doctor never told you to. Most people associate fiber with digestive health, and yes, it helps with that. But soluble fiber, the kind that dissolves in water and forms a gel in your digestive tract, has a direct and powerful effect on cholesterol metabolism. Here is why. Bile acids are produced in your liver using cholesterol as a raw material. After they are released into your digestive system, they are normally reabsorbed and recycled. Soluble fiber interrupts that recycling. It binds to the bile acids and carries them out of the body. Your liver then has to make new bile acids, and to do that, it pulls cholesterol out of circulation. Your LDL drops. The mechanism is that direct. Foods richest in this type of fiber include oats, barley, psyllium husk, lentils, black beans, apples, flaxseed, and carrots. A meta-analysis published in the American Journal of Clinical Nutrition, covering 37 randomized controlled trials in over 1,000 participants, found that regular consumption of beta-glucan, the specific soluble fiber in oats and barley, reduced LDL cholesterol by an average of 5 to 10% over 12 weeks. 5 to 10% is a meaningful clinical reduction, and nobody needed a prescription to achieve it. The practical takeaway here is simple. Start your morning with steel-cut oats instead of toast or cereal. Add a tablespoon of ground flaxseed to whatever you are already eating. Eat 1 cup of legumes per day, whether in a soup, a salad, or a side dish. These are not dramatic lifestyle overhauls. They are small, consistent additions that produce measurable biochemical change. Step 3. Move in a way that targets your metabolic machinery, not just your waistline. Exercise and cholesterol have a relationship that most people misunderstand. Aerobic exercise, the kind that raises your heart rate for a sustained period, has a modest direct effect on LDL, but it has a powerful effect on HDL and triglycerides. And HDL, your good cholesterol, acts like a cleanup crew for your arteries. It picks up excess cholesterol from arterial walls and carries it back to the liver for processing. Higher HDL means better arterial maintenance. But there is a second mechanism that most people miss entirely. Resistance training, lifting weights, using resistance bands, doing body weight exercises, improves something called insulin sensitivity. When your muscle cells respond better to insulin, your liver receives less of the signal to overproduce triglycerides. The metabolic cascade that drives dangerous cholesterol patterns begins to slow down, not because you burned a certain number of calories, but because you changed how your cells communicate. A study published in Arteriosclerosis, Thrombosis, and Vascular Biology followed sedentary adults over 50 through a 12-week combined aerobic and resistance training program. At the end of the study, participants showed an average 11% increase in HDL and a 17% decrease in triglycerides without any significant changes to their medication regimen or diet. The exercise itself was the intervention. 3 sessions per week, 45 minutes each. That was it. You do not need a gym membership. A 30-minute walk combined with 20 minutes of bodyweight exercises like squats, modified push-ups, and resistance band rows performed 4 times a week will produce real metabolic change over time. Step 2. Address the inflammation your standard blood work is not measuring. This is where I want your full attention because this is the part most people never hear. Chronic low-grade inflammation is now understood to be a central driver of the cholesterol patterns associated with cardiovascular disease. Not the obvious inflammation of an infection or injury. The quiet, persistent kind. The kind that smolders inside arterial walls over years without producing symptoms you can feel. The kind that comes from poor sleep, chronic stress, a diet high in processed seed oils and ultra-processed foods, and inadequate intake of omega-3 fatty acids. The reason inflammation matters for cholesterol is this. When your arteries are inflamed, LDL particles are far more likely to be oxidized and trapped inside arterial walls where they form plaque. The same LDL level in a low inflammation environment causes far less damage than in a high inflammation environment. Treating the number without treating the inflammation is like mopping the floor without fixing the leaking pipe above it. C-reactive protein is a blood marker of systemic inflammation that any physician can order. If your C-reactive protein is elevated alongside elevated LDL, your real risk is substantially higher than LDL alone suggests. And if your C-reactive protein is low, your risk may be considerably lower than your LDL number implies. Ask your doctor to run this test. What lowers chronic inflammation? Omega-3 fatty acids from fatty fish like salmon, sardines, and mackerel. Extra virgin olive oil. Colorful vegetables rich in polyphenols. Consistent sleep of 7 to 8 hours per night. Stress management practices that actually reduce cortisol, not just make you feel temporarily calmer. And reducing or eliminating ultra-processed foods, which contain combinations of refined sugars, seed oils, and preservatives that directly promote inflammatory signaling at the cellular level. A landmark study from the Harvard School of Public Health followed over 45,000 adults and found that those with the highest dietary intake of anti-inflammatory foods had a 30% lower incidence of major cardiovascular events compared to those with the lowest intake. 30%. And none of them were taking anti-inflammatory medication. Their food was doing the work. Before I give you step 1, I want to tell you about a patient of mine. His name is Robert. He was 63 years old when he first came to see me, and his total cholesterol was 294. His LDL was 191. His triglycerides were 267. His HDL was 38. His doctor at the time had already written him a prescription, but Robert had not filled it. He wanted to understand what had caused the problem before he committed to a lifetime of medication. And so we sat down together and went through everything. Robert was a retired contractor. He ate cereal and orange juice every morning, drank 2 to 3 sodas a day, ate out for lunch most days, and rarely, if ever, ate fish or vegetables. He walked occasionally but had no structured exercise. His sleep was poor, 5 to 6 hours most nights, and he described his stress level as high but manageable. He did not think of himself as someone with a bad diet. He thought of himself as someone who ate normally. Over the next 16 weeks, we made 5 specific changes, the same 5 I'm sharing with you today. He replaced breakfast cereal with steel-cut oats and ground flaxseed. He eliminated sodas entirely and replaced them with water and sparkling water. He ate fatty fish 3 times per week. He started walking 30 minutes daily and added resistance band training 3 times per week. And he began prioritizing sleep, targeting 7.5 hours per night consistently. At the 16-week mark, Robert came back for follow-up blood work. His total cholesterol had dropped to 218. His LDL had come down to 126. His triglycerides had dropped to 144, and his HDL had risen to 52. No prescription, no supplement stack, no expensive meal delivery service. 5 changes, 16 weeks. Robert still sends me a message every year on the anniversary of his first appointment. He has not needed that prescription. He understands his body in a way he never did before, and every single number in his metabolic panel reflects that understanding now. Step 1, the most important step. The one that surprises people the most. Fix your sleep. I know that sounds too simple. I know you came here expecting a food, a supplement, a specific protocol. But the research on sleep and cholesterol metabolism is some of the most compelling data I have seen in 15 years of clinical practice, and it is almost never discussed. Here is the mechanism. During deep sleep, your body performs its most important metabolic maintenance. Cortisol, your primary stress hormone, drops to its lowest daily level. Your liver, freed from the constant cortisol signaling it receives during waking hours, shifts into its most active cholesterol clearing mode. Your cells become more sensitive to insulin. Inflammatory markers decrease. HDL production increases. Every single process I have described in the previous 4 steps functions better when you are sleeping properly. Now flip that picture. When you are sleeping 5 to 6 hours per night, your cortisol levels remain chronically elevated. Chronically elevated cortisol signals the liver to produce more glucose, more triglycerides, and more inflammatory compounds. It suppresses HDL production. It promotes the small, dense LDL particle pattern, and it creates a hormonal environment in which no amount of dietary improvement fully compensates. A large population study published in the journal Sleep Medicine analyzed cholesterol and sleep data from over 32,000 adults. Participants who consistently slept fewer than 6 hours per night had significantly higher LDL, higher triglycerides, and lower HDL compared to participants who slept 7 to 8 hours. The association held even after controlling for diet, exercise, weight, age, and sex. Sleep was an independent predictor of cholesterol pattern. Independent. The practical implication is this. If you are making every other change in this video but still sleeping poorly, you are running a marathon with a weight vest on. Your biology will work against every positive choice you make during your waking hours. Sleep is not a luxury. For your metabolic health, it is the foundation that every other intervention rests on. Improve your sleep environment. Keep your bedroom cool and dark. Establish a consistent bedtime and wake time, even on weekends. Reduce screen exposure in the 90 minutes before bed. Stop eating within 2 to 3 hours of sleep. These are not complicated instructions, but they require consistency. And consistency is what produces the measurable, lasting change you have been looking for. Let me bring this together for you now. Your cholesterol is not a mysterious number generated by bad luck or genetics alone. It is a reflection of how your liver is functioning, how inflamed your arteries are, how sensitive your cells are to insulin, and how well your body is recovering every night. Every one of those factors is within your influence. You learned today that cutting refined carbohydrates directly reduces the triglyceride and LDL particle pattern most associated with cardiovascular risk. You learned that soluble fiber, specifically the kind in oats, barley, flaxseed, and legumes, physically removes cholesterol from your body through a mechanism your prescription pad cannot replicate. You learned that exercise, and specifically the combination of aerobic movement and resistance training, restructures your metabolic signaling in ways that change how your liver produces and clears cholesterol. You learned that chronic inflammation is the hidden amplifier of cholesterol-related risk, and that what you eat, how you sleep, and how you manage stress all feed directly into that inflammatory level. And you learned that sleep is not the bonus step at the end of the list. It is the foundation. Without it, the other 4 work at half capacity. These 5 things together produced the results Robert experienced. Not one of them alone. All 5, consistently, over time. Think of someone in your life right now. Someone you care about. Someone who might be sitting at home with a cholesterol report they do not fully understand and a prescription they are not sure they want to fill. Share this video with them. Not as a medical recommendation, as an act of care, because the information in this video might start a conversation that changes the direction of their health. And that is worth 30 seconds of your time. If this video helped you, please subscribe. I release a new video every week covering exactly this kind of information, the kind that turns a lab number into something you actually understand and can act on. And in the next video, I am going to explain something that affects nearly everyone watching this right now. Something inside your morning routine that is quietly raising your fasting blood sugar, even if you have never been told you are pre-diabetic. That one is important. I do not want you to miss it. I am Dr. Christian O'Brien, and I will see you in the next one. Take care of yourself.